The condition of the patient can be described as good if the vital signs are normal and the general outlook shows faster recovery. Patients with a good medical condition are able to feed themselves, and the method of feeding in such cases is by oral feeding. If the vital signs of the patient are not consistent and vary from time to time from the normal limits, and if the patient is conscious, then the condition of the patient is described as fair. Such patients can also be fed through the normal oral method with consistent assistance and monitoring. In cases where the patient's vital signs are not normal and patients are conscious but are unable to perform activities by themselves, the medical condition is described as serious. In such cases, nutrition and the method of nutrition are very critical for the patient, and the doctors closely monitor the patient's diet and feeding. Some patients are in an unconscious state, and some of the vital signs are maintained by support systems. Such patients are said to be in critical condition. IV fluids are given to such patients for their nutrition. Conditions that have been detected in the patient before joining the hospital and conditions that have been identified within the hospital, such as diabetes and high blood pressure, need special feeding instructions. You must check with the nurse about the condition of the patient before planning the feeding method for patients in different medical conditions. Methods of feeding in patients under different medical conditions. In patients who have suffered from a stroke and are immovable, feed the patient from the side that is not weak. Put the spoon on the side of his mouth where there is feeling. Be sure food is being swallowed and not collected on the numb side of his mouth. Put solid food on the tip of the spoon, in small bites. If the patient tends to choke, give some water or other liquids with a spoon. This will help the patient swallow the food. Patients who are suffering from a spinal cord injury are bedridden, and food given to them can enter the lungs. So, ensure that food is swallowed properly by the patient. In case of patients with injuries due to accidents, ensure that patients consume food normally. If they do not eat properly, then the rate of recovery will be very slow. While feeding patients who have vision problems, always describe and tell the food that is to be consumed. Help these patients by cutting and chunking the food into small pieces, and by keeping these chunks within their reach. The type of food that needs to be consumed by a patient suffering from a given medical condition and the food items that need to be avoided are listed by the dietitian. Patients suffering from medical conditions like diabetes need to be fed regularly. Give them small meals of the given diet every 2 to 3 hours as they can be weak. Check with the nurse on the condition of the patient and arrange for all the items listed by the dietitian before you begin the feeding of the patient. Precautions while feeding a patient with a medical condition. Only feed the patient at a pace he or she is comfortable with. Check the diet of the patient with the dietitian or the nurse before feeding the patient. Make sure the patient is completely awake and alert before feeding. Make sure the patient's food or liquids are of the correct consistency before feeding them to the patient. Check the temperature of the food or liquids to ensure each item is suitable for the patient to consume. Check to see if the patient has any food allergies before feeding. Do not feed the patient an item he or she may be allergic to. If the patient begins coughing excessively or choking, stop feeding immediately. Provide appropriate care and notify the healthcare provider. Never rush the patient while eating. Never feed a patient who is not properly positioned.